Considered as a symbol of femininity and motherhood, every woman needs to take care of their breasts. One of the biggest threats that comes across the way is breast cancer, being the second leading cause of cancer death in women, but can be cured with early detection. How come using AI technology for cancer screening can provide results within better accuracy and reduce the percentage of false negatives? Let's take a look at it. Who is at risk? Breast cancer, the most common cause of The most common cancer occurs in every country in the world despite any gender. But the risk factor is strongest for women with about 99% and men with around 0.5 to 1%. Aging, obesity, heavy alcohol consumption, radiation exposure history, family history of breast cancer, reproductive history, including age at first pregnancy and menstruation onset, tobacco use, and postmenopausal hormone therapy are some of the factors that raise the risk of breast cancer. Other than age, over 40, and gender female, women without any known breast cancer risk factors account for around half of all cases of breast cancer. Although the majority of women diagnosed with breast cancer do not have a known family history of the disease, having a family history of breast cancer enhances one's chance of developing the disease. A woman's risk does not always decrease if her family history is unknown. Did you know that breast cancer during pregnancy is rare? It is extremely distressing to learn that you can have breast cancer while you're pregnant. You will probably experience a range of feelings, such as fear, grief, or rage. The majority are able to continue with their pregnancy. Rarely, some women might have to consider getting a pregnancy termination. Knowing these truths is startling. It was found that in 2022, around 2.3 million women were diagnosed with breast cancer and caused 670,000 deaths globally. It is accounted for in countries with very high HDI, Human Development Index, where 1 in 12 women were affected with breast cancer in their lifetime, and 1 in 71 women died due to it. In contrast, in countries with low HDI, where only 1 in 27 women is diagnosed and 1 in 48 of them dies. So what are the signs and symptoms of breast cancer? Early cancer identification is crucial because the majority of people do not exhibit any symptoms when the disease is still in its early stages. Combinations of symptoms are common in breast cancer, particularly in more advanced stages of the disease. Breast cancer symptoms can include breast thickening or lumps, which are frequently painless, changes in breast size, shape, or appearance, dimpling, redness, pitting, or other skin changes, changes in the appearance of the nipple or the skin around it areola, and abnormal or bloody nipple fluid. Even if a breast lump is not painful, the person should nonetheless get medical attention. Not all breast lumps are cancerous, although it is possible to have cancer-bearing lymph nodes that are not filled. The lymph nodes under the arm are frequently the first detectable sign of dissemination. Cancerous cells have the ability to spread to other organs such as the brain, liver, lungs, and bones over time. Once they get to these locations, further cancer-related symptoms including headaches or bone pain could manifest. What are all the treatments available? The course of treatment for breast cancer is determined by the specific subtype of the disease and the extent to which it is spread to lymph nodes, stages 1 or 3, or other regions of the body, stage 4. To reduce the likelihood of a cancer recurrence, doctors combine therapy. These consist of radiation therapy to lower the chance of recurrence in the breast and adjacent tissues, surgery to remove the breast tumor, and drugs that destroy cancer cells and stop them from spreading, such as hormone treatments, chemotherapy, or biological therapies with specific targets. Early initiation and completion of treatment for breast cancer results in greater efficacy and higher tolerance. A lumpectomy, or removal of only the malignant tissue, or a mastectomy involves removing the entire breast. To evaluate the cancer's potential for metastasis, lymph nodes may also be surgically removed. Radiation therapy reduces the likelihood of cancer returning to the chest wall and treats any microscopic malignancies that are still present in the breast tissue or in lymph nodes. Advanced malignancies may not always hurt, but they can erode through the skin to leave open sores. Ulceration, it is called. Women who have non-healing breast sores ought to consult a physician to have a biopsy done. How can it be identified? One of the productive ways to reduce breast cancer-related mortality is screening if breast with mammography. What is mammography? The use of low-energy X-rays to particularly examine the human breast for diagnosis and screening for cancer cell detection is called mammography. Screening helps in early detection, which can lead to better chances of survival. However, a large number of women have to be screened and repeated reading of test outcomes has to be done to produce a better and accurate result. However, this creates a heavy workload that endangers efficacy, particularly considering the increasing scarcity of screening radiologists around the world. Moreover, the most important thing in cancer detection is false negatives. False negatives are appealing, where the cancer was there but it wasn't essentially noticed, which can lead to delay in treatment. It is mandatory to reduce the interpretation errors of visible lesions at the digital mammography, which can lead to at least 25% of detectable cancer being missed. In a study by Imperial College London, the result of AI breast cancer screening has been a 9.4 reduction in false negatives in the US, which means doctors missed the cancer sometimes, but with the help of AI, they spotted it 9.4% more. What typically does AI do? The basic concept of AI refers to the simulation of human intelligence in machines, allowing them to perform tasks that typically require human condition. Bringing AI into the prediction is not just a medical advancement, but also a lifesaver for the patient. It not only helps the patient to get a buffer time to get treated, but also enhances the personalization of treatments, streamlines operations, etc. Data-driven insights will provide a more efficient healthcare system and better patient outcomes. The root of the application of AI in the prediction of breast cancer dates back to 1990, when computer-aided detection software for mammography was introduced. Google Health has developed an AI to learn the complex features present in mammograms that are likely to show the signs of cancer that cannot be detected by some specialists. The AI can translate between different screening populations and settings without additional training data. The AI is also capable of providing automated, immediate feedback in screening settings. Google has promised that in future clinical deployments, the system might offer strong baseline performance, but it could be more beneficial from fine-tuning with local data. From the time being, the optimal use of screening for the detection of breast cancer with the help of AI within the clinical workforce remains to be determined. The major advantage of the system is its specificity, which could help reduce unnecessary biopsies and recall rates. To build this, Google went hand in hand with clinicians, patients, and health professionals to understand the depth of the disease more clearly. They are working with Northwestern Medicine to research how the research model can help prioritize high-risk cases and shorten the time to diagnose for screened individuals. Also, with Imperial College London and 3 NHS trusts to understand the research model, CAM acts as a second independent reader. Research, in reality, is made sure by leading partnerships like ICAD and with the Japanese Foundation for Cancer Research at Reich hospitals to improve the inclusivity of the models. The doctors themselves are very optimistic about the use of AI in detection. It is the people's health that matters the most. These medical advancements are not made to replace human doctors, but the actual goal is instead to empower them and take off as much weight from their shoulders as possible. It is to work alongside with doctors. We could conclude it at its best with the usage of this particular AI can impeccably reduce the workload of doctors by 88%, which is an amazing result. This additionally adds that AI would substantially help to reduce not only the workload of doctors in developed and wealthier countries, but also in developing countries and to people who cannot afford much on these tests without any delay and with perfection. So to all my lovely ladies, get tested at least once a year. Don't forget to share this with your favorite woman and give it a thumbs up. Do subscribe to our channel. Until next time.